name is Michelle. I've been a pediatric kidney transplant coordinator for about 8 years. I handle pre-transplant to post-transplant. I work them up for transplant. Once they get transplanted, I go to the hospital and do all of the education about life after transplant, all the medications they're going to be on. I take care of them in post-transplant clinic until they are 21 years old. What I tell our families in pre-transplant when they don't know us, like, we're going to become a family. There's maybe some mistrust because your kid's on dialysis and the world is closing in on you and you just don't know what's going on, and we are going to be like family by the end of this.
What are some techniques you provide for pediatric patients and their families for dealing with the emotional burden of kidney failure?
Everyone, please try to get into therapy. Transplant doesn't always fix necessarily what you're feeling. You're going to be chronically ill for the rest of your life. There's going to be doctor's appointments, there's going to be medications, there's going to be reminded for the rest of your life that you're different. A patient can say, but I feel perfectly. And they don't realize that there's always trauma in chronically ill kids, that they don't realize that's lingering there, that may come out in ways that they don't expect when they're 25, 30, 35. It's imperative that they take the medications every single day and on time. I tell them, like, hey, you're not taking your meds. I can see that. I know, the doctors know, we all know where that's going to end up. It's incredibly sad, and that's the hardest thing to watch. Every doctor tries, a psychiatrist tries, a social worker tries, and that's the most difficult part, is wanting something so badly for someone to just care about themselves, to care about their health, and they don't want it for themselves. It's very, very hard to watch because they have this precious gift of life, and they're not taking care of it. And that's what we tell kids all the time, that we wish the kidney would kick you and say, hey, I don't feel good. But it doesn't. You feel perfectly fine. It's the same way as when you're losing your native kidneys. You feel perfectly fine until you don't one day. It's very important that you go to your doctor's appointments, that you don't no-show. Suddenly your creatinine's 12 and you're in the ER because you're vomiting and you just feel like horrible, and it's too late.